So I'm going to welcome Irene onto the Rehab Power Hour today. I believe Irene has a full cast there with her. I'm excited to chat with her whole crew. So welcome, Irene, to the Rehab Power Hour.
Thank you.
Yeah, well, if you wouldn't mind, start off, maybe tell me who you are, where you calling from.
I'm Irene Muyo. I'm Purple Township.
Sh- she's uh, having difficulty in speaking because of her stroke.
Okay, that's totally fine, guys. I'm happy. Let me ask you a question, Irene. Do you have difficulty understanding me? Are you able to understand what I'm saying?
I understand what you are
Okay,
saying.
very good. I just wanted to make sure that we could communicate effectively or if I needed to adopt a different strategy. Okay, very good. Well, Irene, who else do you have there with you?
My husband Elmo
Okay,
and my son Timothy.
okay. Elmo and Timothy, is that correct?
Yeah,
Yes.
Very good to meet you both. I'm so glad you guys could all be here today. So, as I said before we jumped on the Rehab Power Hour, my main goal is to be helpful for you, to be a resource. And so, I'll just start off by asking, what kind of questions do you have that I can help answer today?
okay.
Um, Actually, I kind of had several questions. So my mom had well, she suffered with, I'm gonna butcher this, acute ischemic
Acute ischemic
stroke.
stroke.
Ischemic, yeah, it's a tough word. Ischemic stroke, yeah.
So how is that going to be able to? How is Motus going to be able to kind of help her regain her mobility? And how will this type of stroke kind of affect her progress?
Sure. So let's maybe break down a couple terms here. So at a super high level, there are things called acquired brain injuries. And that's a big category, a big tent. These can be traumatic brain injuries or other sort of things like a post-surgical tumor resection, but also a stroke. And then strokes, specifically cerebral vascular accidents, they have two types of strokes at a broad category. One of them is a ischemic stroke, and the other is called a hemorrhagic stroke. Now, fundamentally, they result in the same sort of problems, and that is parts of the brain that control various aspects of your movement, your sensation, your ability to speak. Those get a sort of lack of blood supply, and that causes those systems to not work as well after that stroke. Now, the underlying causes are slightly different. One is a brain bleed, and the other is, as you guys had, a ischemic stroke when it was like a blockage. And that blockage, you can imagine like a river being dammed up, and anything downstream of that is not going to have adequate water supply to make it healthy. That's
Right.
different than like my analogy kind of breaks down here for hemorrhagic strokes, but you can imagine basically the water being diverted. If you had a dam and it was being diverted into other areas because, if there was a burst somewhere, that would cause the same sort of problem where the areas that were supposed to get water don't get water.
Right.
And that's what's happening in a hemorrhagic stroke. Now, with respect to how we recover from a neurologic injury, it's a really, really broad topic. And I could spend hours and hours and hours talking about this, but I will be very respectful of your time and just talk about some of the best practices when it comes to this. The primary thing to note when we think about neuro recovery is making sure that you are hemodynamically stable, medically stable. That's the sort of primary thing. We want to make sure that there's not going to be any risk of other types of neurologic disorders, other additional brain bleeds or additional strokes that can emerge. Now, provided that we have those things controlled, then we think about how do we improve your brain's function as it relates to your ability to move and or to have a good quality of life and good sort of sensations and experiences.